Hi everyone, Adam here from Kinetics Physiotherapy, coming back again with another video, this time about tennis elbow. In this video we'll cover what tennis elbow actually is, why it happens, what puts you at an increased risk of developing tennis elbow, what you can do to fix it, and how long it will take to get better. So let's start with what is tennis elbow. So tennis elbow is essentially inflammation of the tendons that sit around the outside of the elbow, around here. And unlike its name, you don't necessarily have to play tennis to get tennis elbow. It just relates to the tendon of the muscles that move your hand and wrist. So if I roll up my sleeve here, you can see them moving a little bit in my forearm here. And as you move the fingers, you move the wrist up and down, the muscles travel along here, they go into this bony bit on the outside of the elbow here, and they travel across, and they go into the fingers and the wrist, and they contract to allow you to move. The inflammation of the tendon that sits in your forearm towards the tennis elbow is caused by a sort of small micro trauma to the tendon. Nothing significant to cause any sort of rupture or tear, nothing like that, but what it causes is a bit of inflammation and aggravation, which causes pain. So why does tennis elbow occur? Tennis elbow occurs for any one of a few reasons. The first one being when there is, or the most common being when there's overuse of that area. So you get overuse of the muscles in that area when you're constantly using them over and over and over again. So that can be as really small tasks or more demanding tasks. So for example, if you're a labourer or a bricklayer, you're lifting up bricks all day, that every time you pick it up, to make sure that your wrist doesn't collapse forward, the muscles in the forearm have to contract to hold a brick every time you go to lay one. That's just one example. That's quite a high demand on those muscles. But it can be even as little as typing all day. If you're sat at a desk, to move your fingers, the muscles in the forearm have to work to move the fingers, and they also have to lift your wrist so you can type, so that the wrist doesn't fall forwards and sit on the keyboard. The inflammation can also come on if there's a strength deficiency and you're asking too much of the muscle. Again, this is something that ties in a little bit to the repetitive strain, but if, for example, you are a bricklayer and you're asking quite a lot of those muscles, but you haven't done any exercises or you haven't got any strength that you did in advance to prepare for that load or that it needs to have, and that strength that the muscles need to have, then it's going to get inflamed, and that's where you get those little bits of micro trauma in the tendon. Another thing that can cause tennis elbow or that inflammation in the tendon is through a lack of flexibility. It usually comes on as more of a feature of getting tennis elbow, but it can contribute and feed into it in the first place and getting it to start. It's if you have poor wrist mobility and poor finger flexibility, particularly when bringing the wrist down like this, because it stretches the extensor muscles, that can be a prerequisite to be more likely to develop tennis elbow in the future. Now, there are a few things that increase your risk of developing tennis elbow. One of them we touched on a little bit earlier, and that's your occupation, what you do for work. If you're desk-based or if you're a manual labour type job and you use your hands a lot on a day-to-day basis, then you're more likely to develop it because there's more of a demand on those muscles there and that tendon in particular. But that's usually the most common thing that I see is somebody who uses their hands a lot. They're unfortunately at a bit of a disadvantage, or they're more likely to develop it in the future. There are a few other health conditions and medications to look at when looking at tennis elbow and increasing your risk of developing it. One of the main sort of medical conditions that will increase your chances of developing it is if you have a thyroid issue or underactive thyroid usually. So that increases your chances of developing a tendon-related issue. It doesn't matter what tendon in the body, but tennis elbow, it affects the tendon here, so you're more likely to develop it if you have an underactive thyroid. From a medication point of view, usually when we're looking at tendon-related issues, if somebody has been taking long-term steroids, usually when we're looking at sort of 3 months, 6 months plus, then it can affect the tendon health. And globally across the whole body, it can affect the tendons, and they become a bit more prone to being aggravated. You'll probably be taking steroids if you have other conditions, sometimes like fibromyalgia, for example. That's commonly treated with some sort of steroid. So what can be done about tennis elbow? Now, if we're looking at that from a physiotherapy perspective, there's quite a few things that we can look at. From a manual therapy point of view, so if the pain is particularly severe and we want to try and settle it down, one of the things that we'll look at is sort of massage or soft tissue mobilization to the area. It helps stimulate blood flow to the area, which helps settle down inflammation. In the future, I'm going to do a video on self-massage and how you can self-help if you have tennis elbow and what you can do at home, because you don't necessarily need someone there to do it. It's quite simple to do on your own, and I'll make a video in the future on how you can do that yourself, so keep an eye out for it. Another manual therapy that you can have to try and tackle tennis elbow is acupuncture. So putting some needles into the area can help stimulate blood flow to the area, helps bring on a somewhat inflammatory response, which stimulates blood flow, which seems counterintuitive, but because you take the needles out, it's not a persistent inflammatory response. It stimulates a bit of blood flow to the area and helps stimulate that healing, but it also has an almost numbing effect on the nerve receptors there, so it can bring the pain right down, which can be really, really useful when looking at exercises. So the next most, or what is the most important treatment for tennis elbow is exercises. So that's to look at whether there's a strength issue or if there's a flexibility type issue, or if you're looking at that load capacity. So if it's job related and you've got that repetitive strain to that tendon, we need to find a way to allow those muscles to cope with that so that it doesn't reoccur, and that's where exercises come in. So that's probably the most important treatment, is looking at exercises, usually exercises which load the tendon. So these sort of exercises off the edge of the table, if you're sat there and lifting a weight, usually a bottle of water, nothing too heavy, and you can look at stretching type exercises like this, and gripping type exercises as well. Often at my clinic we hand out putty as a bit of resistance for those sort of exercises. The next thing to consider to try and manage the symptoms while it's healing is you can buy a tennis elbow clasp. So they're sort of almost like a band that you can buy, and they have a hardened plastic bit on them, and they tend to be a sort of Velcro, and they clamp around this part just below the elbow here. Not too tight, you can loosen it off if you need to, and it essentially puts a bit of pressure on the area or the tendon that's giving you trouble, and that can help support the area, and then you get less pain from it, which can be really useful if, for example, you have a desk-based job. It just takes the pressure off, gives it a bit of support so you can get through the day and it's not flared up too much, so that when you get home you can look at those exercises to try and settle it down and move forwards and actually resolve it in the future. And the last sort of manual treatment that I would look at, it's something that's not often considered, is that when you have tennis elbow, there's a lot of nerves that travel down from the neck, down the shoulder, down the arm, and they become very superficial. They come to the surface around the elbow, between the inside and the outside of the elbow here. So one thing to look at is how much movement you've got around the mid-back. So usually we're looking at rotation movements, and if that's limited, that can feed into tennis elbow. It can cause usually 10-20% of the pain that you're experiencing. So sometimes, although I'll focus most of the treatment around here, sort of soft tissue, a bit of acupuncture as well in exercises, it is worth looking at the mid-back here, and you can have, sometimes I give out or do spinal manipulations to more around the thoracic, the mid-back, because it loosens things up, gets things moving, gives the nerves a bit more room to breathe, and actually can significantly settle down the pain that you're getting around here, which again can be really useful to give you a bit of a breather, give you that window of opportunity to do the exercises so you can build up that strength and that load capacity so it doesn't come back in the future. So how long does tennis elbow take to get better? And like all tendon related issues, it's variable depending on the person. Usually the ballpark figure that we give is 6 weeks plus, but that is a ballpark figure. It is very different between people. Usually what you would experience is that with the right sort of exercises and with a few sessions of manual therapy mixed in, you should start to see some improvements at 6 weeks, some minor improvements. Either the exercises get easier or you're able to do a little bit more before the pain comes on. Nothing extreme, not any resolve of symptoms. Not to say that it wouldn't resolve within 6 weeks, it's just unlikely. And then what you find is that if you keep doing those exercises, then it'll keep improving, and you usually start to see more people resolve their symptoms around the 3 to 6 month mark. But usually if you open a textbook and you look at how long it's going to take to get better, it would be about 6 weeks plus. So looking at tennis elbow as a whole, there are a few other things that play into it, like we've mentioned before, the movement that you've got around the mid-back, the thoracic spine there. You can also look at some self-massage and some self-help type exercise, type mobilizations, soft tissue mobilizations. You can look at things like acupuncture as well, which can be really, really useful and really, really good at settling down really painful tennis elbow. So what I'll do in the future, let me know in the comments below if you think it's a good idea, but I'll look at trying to do some follow-on videos with thoracic mobility routines, back mobility routines, which will really, really help, that you can follow on a daily basis. Same with tennis elbow exercises that you can put on a video and just follow it along. And if you do that on a daily basis, then you should see some improvements. And if you like as well, I can show you a couple of videos on acupuncture techniques that you can not do on your own, but get someone else to do, to give you an idea of what to expect, because a lot of people are very apprehensive about needles. I personally am not a huge fan of them, but with acupuncture, they're so fine you barely even feel them. So if it'll make you feel better, or if you're interested to see, then let me know in the comments below. And that's a whistle-stop tour on tennis elbow and what you can do to try and fix it. If you have any other questions or any feedback or anything else that you want me to go through, then please let me know in the comments below. And also leave a like, subscribe, and share with everyone else. And I'll leave a link to my other pages, like my Instagram page, in the description below. And again, let me know in the comments if there's anything else you want me to cover in the future. All right, thanks everyone.